if you look for the published guidelines in diagnosis of multiple myeloma, you realize that from the International Myeloma Working Group, we have updated, in the last 2 years, we have updated not only the diagnostic criteria, but also the risk assessment procedures and the response of treatment assessment. So this is not a coincidence. It means that we changed in these last few years the way we are looking to this particular disease. And probably the tip of the iceberg, the most important change, is that we are not treating end organ failure patients anymore, but we are treating those patients before that, based on the biological markers that predict the progression of disease. So the main focus of my presentation was to discuss those biological markers and why this change happens in 2016. They have to include some studies in the diagnostic workup in order to identify those biomarkers that were not completely unavoidable before this change. And from the moment they do those procedures, the risk assessment is much more refined, and so they are more comfortable to take clinical decisions of treat or not to treat the patients. The treatment of multiple myeloma, it's evolving very rapidly. That means that we are now treating patients with drugs that were not available 2 or 3 years ago. So it's not easy to define a scenario for the future of these patients. But things are very enthusiastic in this area, and I think the future will be great.